Derek Marquez. We have Regional Director Marilu Toledo, DTI. With PD Cortez. We have Assistant Regional Director Paula Pasidjonko of the Department of Health. We have Assistant Regional Director Nat Liano of DOLE. We have regional representatives from WHO. We have Dr. Mike Campuel. This is Mike. And from the region, we have Brigadier General Alex Rillera, Commander 202nd Brigade. We have Brigadier General Marceliano Teofilo from AFP. We have from DSWD, we have Ricky Bunao. Hindi ko na maintindihan. What's PIA? From PIA, we have Christina Azadon. And from the Philippine Commission on Women's chairperson, we have Sandy Montano. Ito na lang. And I think we also have representative via Zoom or visitors via Zoom who's joining us today, the municipality and city health officers of Cavite, headed by their president, Dr. Ruth Punsalan. Okay, I'll give you the mic if I didn't, if I failed to mention somebody else.
Yes, Doc. On the way po si ASEC, Maria Francia Laksamana of DOH. Yeah. And also Secmon Lopez is coming too. Okay, so let's proceed na po. Also, nandito na rin po si Mayor Yuri Pacumio of Tenza. Good afternoon po. Ayan. Okay. So now, let's hear a message from our Governor, ang tapat sa bayan, tapat sa usapan, Governor John Vic Remulla.
Maraming salamat po sa inyo lahat. Thank you very much, General Magalong, Secretary Duque, Secretary Vince, Secretary Andanar, sa lahat ng mga national officials at mga local government nandito. Hopefully, today's meeting will put more clarity on the policies and the direction that the province and the country will go to regarding COVID. We are now at 2,650 So we are trying our best to contain it. We welcome the inputs from General Magalong on the contact tracing. But we've been following your prescriptions from the start on how to do this. But we hope that at the end of this meeting, we will have some clarity on what is going on. Mr. Secretary, for the purpose of the consumption, there is now a viral message going around that Region 4A will be put under ECQ starting next week. If we can get a clarificatory statement on what the policy of the IAPF will be, so that it can be relayed to the people around Cavite and Region 4, because there's a sense of panic buying going on now because of the, I don't know if it's fake news, but there is news going around that will be put under ECQ. Thank you very much.
Thank you, Gov. So at this point,
Excuse me,
yes po,
ma'am.
Secretary.
Para lang matugunan natin kaagad itong kumakalat na balita na isa sa ilalim ang Calabar Zone, Region 4A sa ECQ ay wala pong katotohanan iyan. Kasi unang-una, yan po ay padadaanin pa sa atin Office of the President at magre-recommenda tayo. So that is rather baseless. So wag po tayo maniniwala rito At ito lang po ang aking masasabi. We cannot preempt what the President will eventually approve. No? Pero yung ulitin natin, hindi po ito nakalagay under ECQ. Maraming salamat po.
Thank you po, Secretary. So it is very clear, ano po, from the Secretary of DOH, Secretary Francisco Duque III, na hindi po magbabalik sa ECQ po. Okay? So now, okay, may I call on ARD Dr. Paula Paz, MC Jonco, for the Calabarzon COVID-19 Situational Report.
Dito na lang. Secretary Duque, Governor Remulla, the rest of the secretaries and undersecretaries, hindi ko na po isa-isahin. And of course, our regional director, Director Hanayo. Good afternoon to all. So I'll be presenting this afternoon the COVID-19 situational report for the Calabarzon region. Next slide, please. So, as we all know, our core strategy in COVID-19 is to prevent, detect, isolate, and treat. Next slide, please. Next, please. So, for prevent, we have the Be the campaign. So, be the solution sa COVID-19. B for bawal, walang mask. I, isanitize. D, dumistansya ng isang metro at alamin ang totoong impormasyon. So we see to it that our constituents are wearing masks. So kung wala silang pambili, pwede din tayong mag-provide. We allot funds to provide them masks. Next, please. Okay. Detect. So, ito po yung total cases as of August 11, 2020, that's yesterday. It's 10,245. And our active cases is 6,475. Recovered, 3,422. Death, 348. And our probable 366. And a suspect of 30,000. Next, please. So, for the province of Cavite, we have 1,391 and active cases. Laguna, the highest, 2,705. Then we have Batangas, 882. Rizal, 1,194. And Quezon, 303. So as I have said, a total of 6,475. And looking at the number of deaths, for Cavite, our case fatality rate is around 3.2. And Laguna is 2, Batangas 3, Rizal is 6, Quezon 3. For the whole region, our case fatality rate is 340. But our recovery rate for the whole region is 33.4, while that of Cavite is 26.66. For our case doubling time, for the region, we have 11.17 days, while our case doubling time for Cavite is 12.35 days. So next slide, please. Ayan, meron pala. So, this is the map of Calabarzon, and as we can see, we have the dark color for Laguna having the most number of active cases, followed by a lighter color for Rizal and Cavite. Next slide. So this is for our contact tracing. So for our contact tracing, we have a total of 570 organized contact tracers, and we have trained 2,985. We have a 96% confirmed cases traced and 99.28% of close contact trace. However, our case close contact ratio is only 1.4. Quezon has the highest, 1:10, followed by Batangas, 1:8, and fortunately Cavite has only 1:3. Our source is from DILG. As we have agreed in our region that the source for contact tracing data is coming from DILG. Next slide. So this is our diagnostic capacity. We have a total of 11 licensed laboratories in Calabarzon. We have 4 in Laguna, 3 in Batangas, and 2 in here in Cavite, and only 1 in Quezon, and no license yet for the province of Rizal. So our daily testing capacity is 3,956 per day only. That is for the total 11. So that's the reason why we still have the zoning of laboratories, and Rizal give their laboratory specimen to Lung Center and the UP Genomics. However, Lung Center is just giving them 15 slots per municipality per day, while UP give them 10. So parang wanting talaga ang laboratory in Rizal, and of course with the whole Calabarzon. Next slide, please. So we still have 5 laboratories that is in stage 3. The Batangas Regional Medical Center is actually on construction, and the construction will be done this month. So we are hoping that they can move up to stage 5 with the infrastructure done. Hopefully, we still have 3 stage 1, so hopefully this will be licensed also, as we have the stage 1 is for Rizal, which is for Antipolo City, and 2 more for Cavite. Okay, next slide. So for isolate, we have a total of 385 TTMFs, and of these 385, the Department of Health was able to certify 324 or 84%. So for Cavite, we have 28, and we have certified 23 or 82%. Next slide. So this is our bed occupancy for our TTMF. A total of 5,739 beds, but we have 24% occupancy for the whole region. For Cavite, we have 47%. So that graph shows our COVID ward beds whose utilization is 50%, and the isolation bed of 16%. Next slide. So this is our patient census in our TTMFs. We have a total of 1,373, and for LSI, we have 319. Next slide, please. So for treat, first our bed and mechanical ventilator. So this is our care utilization rate. So for our ICU beds, we are already at a warning zone, 69.18% for ward and severe and critical cases, also at 67 on 64%, as well as the isolation beds of 62%. Next slide. So makikita natin dito yung hospitals natin. Naka-red na po yung Cavite for the ward and ICU, Laguna for their wards, Rizal for their ICU, and Quezon for their ward and ICU beds. Next slide, please. This is for the availability and sufficiency of commodities. These are the available commodities at hand. Next slide. So that is the commodities per province. Next. And the availability as in the graphical presentation per commodity. Okay, so if it's red, that means it's already in the danger side. So far, we are still good for this week. Okay, next slide. So these are our issues and concern. Next slide. So first on our data. So initially, there were different sources and reporting templates. There were discrepancy and, of course, late reporting and submission of reports. So what we did, coordination meetings, reconciliation of data, and close coordination and sharing of data. And we followed up daily report from the hospitals. So we also conduct daily reconciliation of activities, coordinated also with provincial coordinators, conduct validation and harmonization, and lately we assigned personnel per province to follow up and remind hospitals on report submission. So at least our data has improved, though it's not yet so perfect. Next slide. So for the logistics and manpower, of course, the insufficient supply, and our actions taken is to procure at the regional level and disseminate our DOH department memos and monitoring of logistics and utilization. So we recommend that the LGUs should also allot funds in the procurement of logistics and to solicit donations from other agencies or partners. Next. For contact tracing, insufficient number of contact tracers. So we have been conducting training of trainers and rollout orientation on contact tracing. And we have conducted also in coordination meeting with DILG, PNP, AFP, and OCD. And we have rolled out 8 contact tracing for COVID-19 orientation, not only to LGUs, but to the concerned agencies. So we recommend that we still hire additional contact tracer to meet the target of 1:800. Next slide. For the laboratory, obviously, we have seen the insufficient testing capacity. So no matter how we increase our contact tracing, if we lack laboratory to read the specimen, parang mahirap pa rin natin mahirap natin maabutan yung target. So we have we have already licensed, as I have said, 11 PCR. We are providing technical assistance through on-site visit to the different laboratory facilities for their accreditation. We provided infra support, manpower, and equipment to Batangas Medical Center. We assist the identified laboratories, the other identified laboratories as well. So our recommendation is to scale up laboratory capacity by optimizing the current laboratories to become a PCR testing center or gene expert. So specifically for Cavite, for the General Emilio Aguinaldo Memorial Hospital, and the Southern Tagalog Regional Hospital, as well as the Antipolo City Molecular Lab. So we need also to procure more PCR tests, cartridges for gene expert, and other laboratory supplies. For patient referral, so the actions taken, CHD Calabarzon have initiated the COVID-19 navigators per province to facilitate and endorse patients to referral. That is aside from the RESO team as well as the HEMS group. So our recommendation is to create a standard mechanism for referral. Another issue is the refusal of patient for admission. So the legal department and our licensing division are coordinating with the hospitals who refused admission, and letters have been sent to this hospital reported to summon an explanation and refusal. So our recommendation is to expedite additional COVID-19 exclusive referral facility. Next slide. So there are those who need financial assistance. So we provided through our medical assistance for indigent patients. And our recommendation is for our local chief executives to augment also the national, to increase the capacity of our local government hospital by providing PPEs, equipment, and even allocating 30% of your beds for COVID patients. Next slide. Actually, I still have another slide, hindi siguro nahabol, that is for the workplaces. We have identified here in Calabarzon workplaces having a current biggest avenue for COVID-19 infection. So it has been traced to several establishments, and the common sources is usually in their transportation arrangement, in their dorms, and in their dining area. So the action done by Calabarzon is to coordinate with these different workplaces to conduct workplace assessment, case investigation, testing, and contact tracing. So we also gave immediate advice for perimeter control, technical advice on comprehensive workplace control, healthcare pathway and referral. And we had a meeting with LCEs and local health staff, as well as regional interagency meetings to include PESA. So we recommend a full linkage and coordination with DOLE, DOH, and DTI, and of course, community engagement and risk communication. So thank you for listening. Good afternoon to all.
Thank you po, ARD, for that very informative report. So at this point, may I request a message po? May we request a message from the National Task Force? Yan. From our Secretary of the Department of Health, Secretary Francisco Duco III.
Okay, maraming salamat po at sa ngalan po ng Interagency Task Force on Emerging Infectious Diseases and in particular ang COVID-19, pinarating po namin ang mainit na pagbati. Kasama ko po ang dalawa pong miyembro ng ating task force. Ito po yung ating testing czar. Walang iba po kung hindi si Kalihim Vince Dizon, who also serves as the concurrent president of the Basis Conversion Development Authority. And we are fortunate. We have our contact tracing czar in the person of the well-known Mayor of the City of Baguio, Mayor Benji Magalong. Palakpakan po natin silang dalawa, ang ating pong mga testing and contact tracing czars. At kasama ko po sa IATF, walang iba kung hindi ang ating magiting at masipag na Secretary of the Presidential Communications Operations Office, si Kalihim Martin Andanar. At ang kasama din po namin ang mga kumakatawan sa mga iba't ibang kalihim at mga miyembro ng Interagency Task Force ay napakilala na po sila kanina. At binabati ko rin po ang ating ama ng lalawigan ng Cavite. Walang iba kung hindi si Governor John Vic Remulla, isa po sa mga rising young executives, local chief executives of the country. And indeed, the province of Cavite is fortunate to have a man of action and a man of vision who is now leading the fight against COVID here in the province of Cavite. And now the purpose of our visit here in Cavite is part of what the National Task Force has been doing. We have been going around visiting various local government units to monitor the general status of the city or of the municipalities where our mayors are joining us in today's meeting. And to remind all of our local chief executives to follow a standard program based on the National Action Plan, nakapalibot po sa atin pong 5 na operational framework. Bago ko po ituloy, gusto ko lang bigyan pagkilala, isa din napakamasipag at napakamagaling na kalihim ng Department of Trade and Industry. Walang iba kung hindi si Secretary Mon Lopez. Tuloy ko lang po kung saan po ako huminto, yung pong paalala sa ating po mga local chief executives na sundin po natin, let us faithfully comply with our 5-point operational framework, which begins with prevention and compliance with minimum health standards, and that was shown on the slide, very aptly captured by the acronym BIDA. Ibig sabihin ng BIDA solution is be the solution to this problem. This is not a fight of the national government alone. This is not the fight of the local government units alone. Neither is this the fight of the private sector alone. The overarching principle that governs our response to COVID-19 pandemic is really a whole of government, a whole of system, and a whole of society response to the pandemic. Secondly, we uphold the principle that to mount a successful response, ang matagumpay na tugon sa COVID-19 pandemic, we need to support the private and public sector complementarity of capacities. So makikita po natin, hindi pwedeng mga ospital lang ng gobyerno ang tutugon. Andiyan po ang pribadong mga ospital. At sa ngayon po, ako'y nakikiusap sa ating po mga private hospitals na kung pwede, itaas po natin ang porsyento ng inyong pong bed capacity na for COVID-19 cases. But having said that, ay sana po ang ating pamunuan dito, ang ating pong mga mayors, ang ating pong gobernador, ay makapanawagan din sa mga pribadong sektor na itaas ang bilang ng kanilang COVID bed capacity to at least about 30%. Kasi ngayon parang less than 15%. At madali pong mapuno kung mababa ang porsyento, may tinatawag tayong artificial surge. Kasi kung mababa ang inilaan mo, madaling mapuno, hindi po ba? Kung madali siyang mapuno, ay talagang lalabas at lalabas sa mata ng madla ng publiko. Uy, overwhelmed na yung kanilang health system's capacity when in fact, to begin with, yung pong kanilang allocation napaka mababa. At isa pa pong naamin na obserbahan ay ang mga pasyente, kadalasan po ay mga mild and asymptomatic ang mga napupunta sa mga private hospitals. At tinatasan na nga natin ang ating treatment czar, head of the One Hospital Command Center, walang iba kundi si Yusek Leopoldo Bong Vega. Ayan po, siya po ang nangangasiwa ng ating pong One Hospital Command Center at akin po siyang pinakiusapan na bigyan paalala ang mga hospital directors, whether public or private, na kinakailangan po ang mga pasyente after 14 days sa kanila pong mga ospital or admission dapat pwede nang i-discharge. Kasi ganun po, hindi naman pwede po na atin aantayin napakamatagal na panahon. You will crowd out other patients who are more in need of admission and hospitalization. So these are some of the points that I would like to stress. At ganun din po yung paglilipaso ng mga guidelines, kaya andito po ang National Task Force para po magbigay liwanag doon po sa ating mga guidelines para nang sa ganun may consistency po ng compliance and implementation. Ano po? And the actual site visit. Pupunta po tayo sa isang barangay mamaya at tutukuyin po natin kung ano ba ang mga best practices dito sa naturang barangay na atin pong bibisitahin maya-maya. At tayo naman po mula sa Department of Health ay meron tayong barangay code team. Ang layunin po nito ay to catch and crush the clusters of infection and to finally eliminate such infection. And of course, ang mga kasama po rito, ang mamumuno po rito, ang team leader, ay ang ating city and municipal health officers or the health center physician to to be assisted by the Development Management Officer 4 at mga iba pang miyembro ng team na ito, itong Barangay Code Team. Ang tanong, ano ba ibig sabihin ng code? Ang ibig po sabihin ng code ay coordinated operations to defeat the epidemic, which is COVID-19. That is the epidemic that we are all fighting against collectively. So kasama po ang LGU staff, ang ating DOH Center for Health Development representative, as well as the DOH Central Office representative. So ang ating po muling layunin dito, ulitin ko, is to provide or to demonstrate high quality, rapid response targeting the clusters of infection in priority barangays and effectively eliminating them. So ito lang po muna ang aking sasabihin, pero maya-maya kapag ating pong tatalakayin, batay po sa presentation ni Assistant Regional Director Dr. Pasi Dionco, yung mga nakita po natin sa mga datos at kung paano po natin tutugunan ang mga tinatawag natin gaps or some deficiencies, which I think will be best addressed if there is an acknowledgement that there are gaps and deficiencies. Because unless we acknowledge such gaps and deficiencies, it will be very difficult for all of us to try to respond to them objectively. So there has to be an acceptance of some of the gaps. Of course, these gaps are not deliberate. These deficiencies are not necessarily made by certain individuals, whether at the provincial level or at the municipal or city levels. But what is important is collectively the national government is here to assist the local government units, and also we take this opportunity to acknowledge the heroism and the sacrifice of all of the healthcare workers of the province of Cavite. Let's all please give all our frontline healthcare workers a big round of applause. Sila po ang nagbubuwis ng kanila pong buhay, nagsasakripisyo para po makapagbigay pangangalaga at pagkalinga sa ating pong mga COVID patients, lalo na po ang mga severe to critical COVID-19 cases. At sila po ang nag-aagaw buhay at samantala ang ating po mga frontline healthcare workers na nangangalaga ay talagang they are also at risk of contracting the infection. And it is small wonder, hindi po katakataka, na meron po tayong naririnig na mga frontline healthcare workers na pumanaw. At masamang-masama po loob natin kapag nakakarinig po tayo ng mga ganitong mga balita. Kaya ang national government kasama ang local government units ay talaga naman nagpupunyagi at nagpupursige na mabigyan ng karagdagang proteksyon ang ating pong mga frontliners, our healthcare workers, by way of a more effective infection and prevention control measures, yung paglilinis sa mga ospital, sa mga operating rooms o sa mga ICU para maibsan ang contamination or ang hawaan. At ang ating pong pagbibigay ng mga personal protective equipment. Director Hanairo, may dala ba tayo ng mga PPEs para po sa atin mga healthcare workers? Ito po ay nagpapatunay na binibigyan prioridad ng Department of Health sa kanya pong budget. Malaki po ang amin pong itinatabi para makapamili, makapag-procure ng ating personal protective equipment. So, yung pong mga testing kits natin, Director Hanairo, Director si Jonko, kailangan asikasuhin natin. Kailangan po napansin natin ang testing output medyo mababa po. Kung isipin natin ay ang national testing coverage, ngayon pong linggong ito ay umabot na yata sa about 1.8 million. Tama ba, Mr. Testing Czar? This is about 1.8 million. Ha? Malapit na mag 2 million, this is about equivalent to 1.9% of the Philippine population. So kung yung po ating pagbabatayan, ang testing coverage dito sa Cavite with a population of 3 million, you get about 2% of that. So kung 3 million, dapat po ang testing coverage natin by now should be more or less 3,300,000, mga 30 to 60,000. Cumulative, ano po. And plus a testing daily output, I think the target will be provided later by our regional director. And once we have identified these gaps, we will have to address them. And very quickly, in fact, for the contact tracing and isolation and quarantine, I have observed that the bed capacity is quite limited. Kailangan palawigin po natin ito. At nakiusap po kami kay Secretary Liling Briones na kung pwedeng paggamit ang mga public school buildings para nang sa ganon ay maragdagan ang kapasidad for immediate isolation and quarantine of those who are a product of an effective contact tracing efforts. So ito po ay isa-isahin po natin pag-uusapan mamaya at muli sa ngalan ng Interagency Task Force at lahat ng mga kasama ko po dito ay pinararating po namin ang aming hangad na makatulong at talagang makamit ang tagumpay na laban sa COVID-19 para po sa ating mga mamamayan dito sa Cavite ay nananawagan ako na ang laban na ito under the spirit of bayanihan. The whole of government, the whole of society approach, we have to win this war together. Hindi po pwedeng maghahanap tayo ng dahilan kung bakit hindi natin maisulong ang ating mga plano at mga programa. Kung hindi, bagkus, kinakailangan po natin, we appreciate what one has to offer and bring to the table so that in the end, we achieve our objective of truly mounting a successful, if not effective, response to COVID-19 pandemic. Maraming salamat po at magandang hapon.
Thank you very much po, Secretary. So before we proceed po to the next, may I acknowledge the presence po of our ASEC Maria Francia Laksamana of the DOH. Good afternoon po, ASEC. Okay, so let's proceed. The next is the local situationer, also the accomplishments and the best practices of the province of Cavite, to be presented by our OIC of the PCAD. Also, she is the Crisis Communication Cluster Lead, Ms. Evelyn Reyes.
Good afternoon sa ating lahat. Yung mga response actions po na ginawa ng provincial government sa pamumuno ni Governor John V. Cremulya ay ipapakita po namin sa pamamagitan ng isang maikling presentation. Ito po ay pinagtulong-tulungan ng lahat ng departments at lahat po ng ahensya na katuwang ng provincial government sa pag-aksyon laban sa COVID.
bayang Cavite, aking mahal, laging patnubay na may kapal. Sa yakap mo ay langit ang buhay at laging makulay. May isang siglo ng nagdaan, bayan mong kawitan kung saan ay sinilang ang kalayaan, ang lahat ay nagdiwang. Cavite, Cavite, lagi ka sa puso ko. Cavite, Cavite, buhay ko'y handog sa'yo. Kung makilakas ko'y laan, ang buhay na may kapayapaan. Cavite, Cavite, ang lalawigan kong mahal. Mahal kita, Cavite, dahil lang sa may kapal.
Okay, so yan po yung situation natin dito sa Cavite and with the best practices as well as the accomplishments po regarding our battle against COVID-19. So before we proceed with the discussion and open forum, iuna po natin ang ating code team presentation. Of course, we would like to hear the messages from our secretaries. Unahin na po natin from our DCI, the Deputy Chief Implementer and Testing SAR. Okay. So before that, I would like to acknowledge, of course, nandito na rin po ang ating Secretary of the Department of Labor, Secretary Sylvester Bello III. So, nandito na po ang ating... Ayan. Okay, so may I call on for a message po, our DCI and Testing SAR, Secretary Vince Dizon.
Magandang hapon po sa ating kaibigan ang ama ng Cavite, Governor John Vic Remulla. Gov, thank you. Tagal na natin hindi nagkita pero si Gov talagang huwag ang kinakatakutan. Kahit ang COVID, hindi natatakot si Governor John Vic. Sa ating pong mga mahal na mayors, matutuwa po kayo dahil actually, itong bisita po namin ngayon, hindi po dito nagtatapos ang ating pagtutulungan dahil sa mga susunod na araw ay bibisita po kami sa kada bayan natin. Bukas nga po, actually, ako ipupunta po sa Dasmariñas kay Mayor Barsaga. Ako po ipupunta tomorrow at sa bayan din ng Imus tomorrow po. No? At yung iba po nating mga secretaries at ating sila Undersecretary Vega, sila Mayor Benji ay pupunta din po sa mga iba't ibang bayan ng Cavite sa mga susunod na araw para po talaga makipagtulungan sa inyo at ibigay lahat ng kinakailangang suporta sa ating mga local government units, lalo na sa probinsya ng Cavite. Alam niyo po, 2 weeks ago, actually po, nauna na kami, Gov, kami po ay nagpunta na kay Mayor Lani Mercado Revilla sa bayan ng Bacoor. Nandito po si Attorney Bern Carrasco, ang kanyang City Legal Officer na kasama namin noon. At simula po noon ay dun sa bisita namin, nagsimula na po ang pagtutulungan ng IATF, ng NTF at ng City of Bacoor. At gusto ko lang po sana i-report sa inyo na sa kasalukuyan ay tuloy-tuloy po ang ating testing sa Bacoor. Dati po, I think ang Bacoor ay nag-average lang ng mga I think about 100 tests per day, if I'm not mistaken, Attorney Bern. Pero dahil po talaga sa pagpupursige at hard work ni Mayor Lani at yung suporta po na inaibigay ng NTF, I think ngayon po ay lampas 500 o nasa 1,000 na per day ang testing ng City of Bacoor. No? At nag-set up po tayo ng mga swabbing centers nila, nag-provide po tayo ng testing kits, at nagbigay po tayo ng training sa kanilang mga local city health officials at mga teams nila sa barangays. At dahil po doon, talagang napataas po natin. At ngayon po, meron po kaming Viber group with Bacoor na yun naman pong nagpo-positibo sa kanila ay tinutulungan naming mag-isolate. Pero bago po nung bisita namin, 2 weeks ago, ay actually binisita na po ni Mayor Benji Magalong ang City of Bacoor. At nagkaroon po ng rapid assessment si Mayor Benji, and I'm sure he will talk about it later kapag po siya ay nagsalita na dito. Pero dito nyo po makikita na ang tanging paraan para talagang malabanan natin ang COVID-19 is kung magtutulungan po tayong lahat. No, magtutulungan po ang national government, ng IATF, ng NTF, at ng ating mga LGUs. That is the only way. Kaya po kami nandito ngayon kasama ng ating chairman, si Secretary Duque, kasama ng ating DTI Secretary, Secretary Mon Lopez, kasama ng ating Labor Secretary, Bebot Bello, at kasama ng ating Communication Secretary at Press Secretary na si Secretary Martin Andanar. Ganyan po talaga ka-importante ang probinsya ng Cavite. At nagpapasalamat po kami muli kay Gov sa inyong pag-welcome sa amin at talaga pong kailangan magtulungan tayo. Alam niyo po, ang Cavite at ang Laguna at ang Calabarzon ay ang industrial capital of the Philippines. Nandito po ang ating mga factory. Nandito po ang factory sa pagkain. Nandito po ang factory sa electronics, semiconductors. Nandito po ang factory sa garments. Nandito po ang ating mga factory sa automotive industry. Kaya napaka-importante po ng probinsya ng Cavite, ng region ng Calabarzon sa ating pagbubukas ng ekonomiya. Narinig naman po natin ang ating mahal na Pangulo nung Lunes. Kailangan na pong magbalik sa trabaho ang ating mga kababayan. Pero ang way lang po para magawa natin yan is kung magtutulungan tayo at i-manage natin ang COVID-19 sa ating communities. Kaya po sa mga susunod na araw, kami po ay bababa sa ating mga cities, sa ating mga LGUs, at talaga pong tutulungan po natin ng maigi ang ating mga LGUs tulad po ng ginawa nating tulong sa Bacoor at kay Mayor Lani Mercado Revilla. So with that po, handa po kaming tumulong, magbigay ng suporta. Ngayon po, I think, Asek Francine, almost 20,000 test kits ang dala po ng NTF, courtesy of DOH, 20,000 po, Gov, no, which will be distributed to the various LGUs throughout the city. And kinukumit po ng DOH na yung mga bago po nating laboratory, i-accredit yan ng mabilis para mas makapag-test tayo ng mas madami at kakibat niya ng ating tracing at treatment na i-discuss naman po ni Mayor Benji at ni Yusek Bong. So with that po again, Governor, sa ating mahal na mayors, sa lahat ng ating regional offices, regional officials ng ating national agencies, sama-sama po tayo dito. We can only beat this together. And sa mga susunod na araw, susunod na linggo, susunod na buwan, tulong-tulong po tayo. Maraming salamat po.
Thank you very much, Sec Vince Dizon. Okay, so next po is the Secretary our Secretary Martin Andonar from the Provincial Communications Operations Office.
Check. Maraming salamat po. Una sa lahat, magandang hapon po para sa ama ng lalawigan ng Cavite, ang idol po ng Cavite, si Governor John Vic Remulla, ang chairman po ng IATF, Secretary Duque, ang idol po ng Baguio, Mayor Benji Magalong, Secretary Vince Dizon, Secretary Mon Lopez, Secretary Bebot Bello, lahat po ng mga alkalde na nandito. Kanina nakapanayam ko po si Mayor Oni Ferrer. Magandang hapon po sa inyo, lahat po ng mga opisyales ng National Government Agency at lahat po ng mga staff ni Governor John Vic. Magandang hapon po sa inyo lahat. Ang nasabi ko lang po ay maikli lang, napakahalaga po ng impormasyon sa mga panahong ito. Marami pong fake news na nagkakalat, alam niyo na po yan. So mahalaga po ay tandaan natin, kailangan accurate yung ating impormasyon na naibabalita. Kailangan po ay responsable tayong nagsishare ng mga balita. Kailangan din po tayong matuto na itong pagiging accurate at responsable. This eventually results to information that is effective for all of us. Halimbawa na lamang, meron pong balita kanina na kumalat na magkakaroon tayo ng ECQ dito sa Region 4A sa ilang mga lalawigan dito tulad ng Cavite, Rizal at Laguna. Yan po ay na-dispel agad ni Secretary Duque. Kaya mahalaga po talaga ang role ng impormasyon sa panahong ito at ang PCOO po ay nasa likod po ng national government. Ganoon din po ay nasa likod din po ng lalawigan ng Cavite. We are just one phone call away. Marami po tayong hinihanda ng mga programa sa pamahalaan. Isa na po dyan, yung laging handa. Yung laging handa ay isang crisis communications program ng gobyerno. Siguro mula nung March na panood nyo na, ito po ay kinikerry ng mga kaibigan natin dito sa private media. Kaya pinapasalamatan po natin ang private media, at yung mga kasamahan natin sa kapisahan ng mga broadcaster ng Pilipinas. Maraming salamat po. At ganoon din po sa local media. Ngayon na meron na po kayong representative mula sa IATF sa ngalan po ni Secretary Delphine Lorenzana, sana po ay maging bukas ang lokal na media dito sa Cavite sa ating kalihim ng Department of National Defense. Muli, maraming salamat po. Let us fight this as one. Let us heal as one. Magandang hapon po sa inyo lahat.
Thank you very much, Prof. Secretary Martin Andanar, Presidential Communications Operations Office. So, isunod na po natin another secretary. Okay? Our secretary from the Department of Trade and Industry, Secretary Ramon Lopez.
Magandang hapon ho sa inyong lahat. Siyempre gusto kong batiin ang ating idol ko na governor. Hindi po dahil sa pinsan ko po siya, kundi talagang idol na idol yan. Boss John Vic Remulla, sa inyo pong pamilya, kamusta po? Sa ating po mga mahal na alkalde ng probinsya ng Cavite, mga kasama po natin sa IATF, NTF, fellow secretaries, ang mga masisipag na USEC, ang mga ZAR, testing, tracing, treatment, lahat na po ng ZAR, USEC, at lahat po ng mga regional directors. Sa ating po mga kasama sa media, magandang hapon ho. So, kami po sa DTI has always been an active part ng IATF at ngayon po ay nasasama at amin po talagang ipinalalapit at ng yung stronger coordination natin po sa national pati po sa local na level. Dahil ang talaga pong susi nito, ang frontliner po, kayo po nasa local government. Kayo talaga nag-i-implement ng ating mga programa panlaban dito po sa COVID-19. Natin lahat na ngayon binabalansin natin at binubuksan unti-unti yung economy. Pero sa pagbubukas, nakaka-experience tayo ng mga challenges na hindi ganun kasimple magbukas dahil ang virus nandyan pa rin. Nag-aabang ng next victim, parating nasa paligid. Hindi naman kilala ni virus kung GCQ na ngayon or MECQ or ECQ. Andyan pa rin yan, naghahanap ng susunod na biktima. Kaya ho, sa pagluluwag, doon tayo nadadali. Kapag GCQ, akala maluwag na. So ang ating pong talagang challenge na ngayon, paano natin maipalit yung mindset ng lahat ng ating, at up to yung mga kababayan natin, sa bahay, sa opisina, sa workplace, kung nasa gobyerno man, nasa public, nasa sasakyan, paano mapapanatili yung pag-iwas, pag-ingat against the COVID-19. Hindi po kinikilala yan kung GCQ, ECQ o MECQ. Kaya po dito ho, sa ating pagbubukas, isa hong na-observe ng National Task Force dun sa economy, pagbukas ng economy natin, sa mga factory, sa mga workers, place of work, nandyan po yung ang laking chance nung hawahan recently. Kaya ho, nagtaasan ng numero natin. Nandyan po yung sa shuttle bus, sa shuttle vehicle, nagkikwentuhan, nagkakainan, tumatawag sa telepono, tinatanggal ang mask. Nandiyan po yung sa kantin, tanggal ang mask, kain, kwentuhan, tabi-tabi. Nagkakalimutan. In other words, bumibitaw po. So yun po yung ating paalala talaga na siguro ho talagang constant reminder na up to the implementation, up to yung ating mga kababayan will have that consciousness and awareness. So dahil po doon, saan naisipan po na at nararapat na palakasin pa yung ating mga workplace protocol. If you remember, nag-issue na po tayo ng workplace protocol way back May, nung nag-uumpisa tayo ng reopening. As of today, in the past 3 days, as we meet different groups, pina-fine-tune up to this morning yung ating bagong set of protocols. Papasadahan ko lang ho ng mabilis para siguro para mamaya kung may Q&A ay masagot pa natin. Kami ho ni Sec Bello, Dole at saka DOH kasama ho sa draw up ng panibagong protocol. So with your indulgence, let me just outline. For example, sa shuttle service, alam natin na require natin ito sa mga companies, lalo na yung malalaki. May definition tayo, 15 million and above. Ibig sabihin, medium size hanggang large size, required yung shuttle. I-require na ho natin. Inside the shuttle, walang tanggalan ng mask or face shield. In fact, naka-face shield. No talking, no eating, no mobile phone, except texting. Kung maaari, kung maiwasan, wala nang phone call. Kasi nandyan po talaga nagkakaroon ng transmission. Yung face shield, madalas kaming tinatanong, required ba talaga yun sa trabaho? Paano kung nakaharap ako sa computer, nakaharap ako sa microscope, nakaharap ako sa mga equipment, pwedeng tanggalin ng face shield, siyempre. Wala ka namang katabi, no? Pero kung ikaw ay makikipag-usap na sa opisina mo, yung mga ganyang detalye ho, pati ho yun, iniintindi namin. Kung may kausap ka na or ikaw ay frontliner, kausap ng customer, kailangan talaga may face shield ka. Or nagmi-meeting kayo, may face shield. Sa guidelines, sinabi rin, gaano kadami sa isang meeting room. So doon na ho madidetalye yon. Sa mga canteens, nirecommend ho namin no dine-in. Pero sa aming pong pakikipag-usap sa mga iba-ibang companies, lalo na yung mga PESA locators, medyo malalaki yan, at inayos talaga nila yung kanilang mga canteen, may mga physical barrier at 1 meter apart, 2 meters apart. Yun ho yung kausap sa smoking si Sec Bello. Bawal na ho yung smoking area na common. Take note, common. Pwede individual. Kung ma-manage na may individual smoking area, may booth, o magkakalayo kayo, bawat puno. Yan ho, pwede ho. Otherwise, kung hindi ho ma-maintain yon, ideally no smoking. Kasi dyan din po sa smoking area, nagkakaroon ng awahan, pag tinatanggal na yung mask, nagsisigarilyo at nagkikwentuhan. So mga ilan lang po yung mga detalye na yon na pati ho yun ay ini-improve natin sa ating protocol. We will be requiring mga companies to provide also isolation rooms with toilet para kung kinailangan, may workers na kailangang dalhin sa isolation room, let's say suspect siya, bago i-test, after i-test, ay nandun po, meron pong isolation room bawat company. Ideally, 0.5%. Tulad po ng ire-require po ng DILG sa bawat barangay na may at least 0.5% of the population. Equivalent po yan, ibig sabihin 1 room for every 200 people or workers. So yun po ang guidelines po natin doon. Kung micro-enterprise, sabihin, wala kaming pera pang paggawa ng isolation room. Ano na lang ho yan. Makipag-coordinate po sa mga barangay para may constant arrangement po. Okay, so ulitin lang po natin, hindi po namin nire-require or nire-recommend ang PCR test or rapid test para lang makapagtrabaho. Kasi po, ang ano natin, protocol mula ho sa DOH, pag symptomatic at may exposure, doon lamang magpi-PCR testing. So yun po, para ho hindi ma-require, hindi ho mag-alala rin yung mga kumpanya. At ano po ito, importante na bago ho mag-testing, sana po itong mga kumpanya nagko-coordinate na po sa mga barangay at saka sa LGUs. Para ho ma-monitor, matrack kung sino yung tinest at ano po yung resulta niya. Para kung may problema ay at least captured na ho natin siya. Again, in this fight in the COVID, ang talagang task po nating lahat, lalo na po si Tracing Czar, ay mahabol, mahanap lahat ng mga possible carrier. Yun po ang big challenge. Kaya ho, ngayon, before the testing, i-coordinate na po. Magkakipag-unay na po sa LGUs. And of course, reporting of the cases, reporting of the result with the LGUs. Okay, and then we have the basic requirements, yung mask, face shield, paghihiwalay-hiwalay, distancing, as well as yung frequent hand washing. Ngayon, last major thing is, bawat kumpanya, we will now be requiring yung health protocol officer, pati ho yung health and safety committee ng bawat kumpanya para ho katulong natin, kasama po natin sila sa pag-secure, pag-ensure ng compliance ng lahat po ng ating protocol. Dahil hindi po natin magagawa yan kahit sa LGU, lalo na po sa national government na matutukan isa-isa. So we will make them responsible. At ang DOLE naman po ay may constant audit ng mga kumpanya at sasamahan na po ng DTI. Kami po sa DTI mag-hire na rin ng mas maraming kahit contractual para tumulong ho sa pag-audit ng DOLE sa mga kumpanya. So yun po, para ho ma-audit at masiguradong they comply. Ang ating lang naman pong requirement ay itong mga kumpanya sumunod. Kung hindi, allowed po tayong mauna mo magwa-warning muna tayo. Pagka binalikan at hindi pa rin sila nagko-comply, pwede ho nating isara. Pero ayaw natin talagang isara. Pero kung kinakailangan para sumunod, isasara po until they comply. Just to allow them to comply. Maybe for 1 day or 2 days. Pag nag-comply, we have to reopen. So that is our only request na ayaw natin silang pahirapan, pero ayaw din naman natin hindi sila sumunod. So it's very important po that they comply. Closure for non-compliance. At hanggang mag-comply, dun po, bubuksan po natin kaagad-agad. So yun lang po. So ang ating, sana po ma-imbibe sa ating mga kababayan yung ingat buhay para may hanap buhay. So sama-sama po tayo rito. Thank you. Magandang hapon po sa inyo lahat.
Maraming salamat po, Secretary Mon Lopez. So next po is our Secretary of the Labor and Employment, Secretary Sylvester Bello III.
Salamat po. Maraming salamat po. Pasensya na po kayo, nahuli ako. Mahal na ama ng lungsod, lalawigan ng Cavite, Governor John Vic. Pasensya na po kayo, nahuli ako. Kasi alam nyo, noong Sabado, kasama ko yung governor namin sa Isabela. Nagdala siya ng pagkain sa bahay, kumain kami. Nag-inuman sila, ako kumain lang. Wala namang babae, Gob, wala. Puro lang. Ngayon, kahapon, nabalitaan ko na nag-positive si governor. Oh, di ba? Nandun natin nabalitaan sa Antipolo. No. Kaya, pagkatapos ng ating tumakbo ako sa Red Cross, nagpa-swab test ako. Kanina hinihintay kong resulta. Ayaw ko naman pumunta rito kung hindi ko pa malaman kung negative ako, positive. Kaya hinintay ko, Gob. Kanina dumating ang resulta, negative. Kaya pumunta ako ngayon dito para bigay galang sa ating mahal na ama ng lalawigan ng Cavite at ang mga punong bayan ng mga iba't ibang bayan at lungsod ng Cavite. Meron paborito akong dito lungsod ko. Pasensya na kayo kasi classmate ko siya Yung mayor doon ni classmate ko. Magtataka kayo bakit ko classmate si Mayor Lani Revilla. Classmate ko po sa Kongreso yon. Hindi ko po, ang layo ng edad namin. Classmate ko si Lani. Kaya sabi ko, Lani, pupunta ako sa Eagle Ridge mamaya. Dahil paborito kitang mayor ng Cavite, bibigyan kita ng 30 na livelihood certificate worth 60,000 each. Ganon. Kaso wala siya. Hindi daw siya makarating. Dumating ba si mayor? Hindi pwede representative. No? Kaya ibibigay ko doon sa paborito ko, number 2, bayan ng Cavite. Gob, bayan ng Silang. Ayan. Ayun. Kasi alam nyo, Gob, nung ako'y estudyante sa San Beda, may girlfriend ako, taga Silang. Oh. Maganda yun. Maganda yun, Gob. Oh, yung ano. Pangalan niya, Joy. Yan, Joy. Wala na, matanda na yun eh. 76 ako, 76 na rin siya. Pero kung buhay pa, hanapin niyo po. Ha? Madre. Nagmadre. Kasi naghiwalay kami eh, kaya nagmadre. Tawa si Yusek Malaya. Totoo yun, Gob. May team song kami yan. Ayoko nang... Ba't alam niyo, Mayor, na nagmadre yung girlfriend ko. Ayun. Maganda, no? Maganda. Oo, maganda nun. Yun ang pinakamagandang dalaga nun sa buong Cavite, Gob. Oo. Ganun ako mag-girlfriend nun. Kaya doon ko na lang ibibigay yung 30 na certificate na sana, ha? Ayo, Mayor, yan, ha? Oo. Ibigay ko. Ayan. Pero, okay, mag-alala sa Bacoor, meron din akong reserve para kay Mayor Lani. Kaya naman. Pero alam nyo, Gob, ewan ko kung ano, alam nyo, pero madalas ako nun dito sa Eagle Ridge. Pero nandito ako dahil naglararo ako ng golf. Oh, maraming magandang umbrella girl dito eh, di ba? Di ba? Maraming umbrella girl dito. Kaya dito ako naglalaro ng golf noon. Eh, ngayon, wala na. Kaya, mabuti naman at pumunta ko ngayon dito para isang bagay na baka sakali ay makatulong kami sa lalawigan ng Cavite. Eh, kagaya ng sinabi ng partner ko, si Secretary Mon Lopez. Alam nyo si Secretary Mon Lopez, partner ko yan. Siyang Secretary ng Trade. Siyang Secretary ng Industry. Siyang Secretary ng Kabuhayan. Business. Kaya ako palagi sinusuportahan ko siya. Kasi pag may negosyo, may trabaho. Kaya kung anong patakaran gusto niyang gawin, okay lang ako. Kasi gusto ko lumago ang negosyo niya para lumago naman ang aking employment. Oh. Kaya sundin niyo po lahat yung sinabi ni Secretary Mon Lopez. Makakabuti sa ating negosyo dito sa probinsya. Ay, Mayor, yung palang 30 para sa mga OFW lang ha. Yan, para sa mga OFW. Kasi, ayan, ito, Mayor, oh. Ito na. Yusek. Oh, ito yung nego card. Negosyo card po ito, Mayor. Oh. Ayan. Mayor, ha? Sige po, good luck po, ha? Okay po. Ayan po. Ay, photo ops pa. Nagmadul na. Pero ba ita? Good naman. Oh. Okay po, Mayor, thank you po. Opo, oji ka pala. Ayan po. Buhay pa pala yung girlfriend ko, Gob. Oh. Nintay pa ako. Apo Jonathan, gusto kong batiin yung aking pinakasikat na mayor sa buong Pilipinas. Ilocano pa naman. Mayor Magalong, apo. Huwag mo naman masyadong istriktuhan ng bagyo. Hindi na ako makakyat ng bagyo. Bawal. Paano ko makapag-golf? Nagsumbong sa akin si Secretary Esperon. Pagdating daw niya doon, sinalubong siya ng maraming pulis. Sabi niya, uy, sikat pala ako dito eh. Sabi niya, yung pala kukunin ng temperature niya. Siyang tracer czar of the Philippines ngayon. Kaya kinakatakutan ko naman pag nag-positive ako Pingkoy, baka iti-treasure niya yung asawa ko. Anyway, mga minamahal kong mga punong bayan, gaya ng sinabi ko, ang kanya ay negosyo, ang akin ay trabaho. Ang aming trabaho sa Department of Labor ay tiyakin na ang mga manggagawa ay hindi mawalan ng trabaho. Ngayon, kung kailangan talaga mawalan ng trabaho dahil magsasara yung mga negosyo, tiyakin natin na matanggap nila lahat ng mga benepisyo nila sa ilalim ng batas. Yun lamang po ang aming paglalaban. At napakaganda itong health standard or health protocol na ginawa ni Secretary Duque at saka ni Secretary Lopez. Kasi ito ay nagbibigay proteksyon sa ating mga manggagawa. At lalong-lalo na dito sa Cavite, napakaraming negosyo dito. Nandito ang mga economic zone, hindi ba? Oo. Kaya I hope that you will spread this, mga mayors. Kayo na pong bahala, ipaliwanag sa lahat ng mga manggagawa, sa lahat ng mga negosyante, na kung mari, sundin po itong protocol na ito. Alam niyo, malaking away namin sa IATF nung sinabi na ipagbabawal ang sigarilyo. Siyempre, ako naman, hindi dahil ako'y naninigarilyo. Kasi po, meron tayong tinatawag, Governor, na tobacco industry. At itong tobacco industry is giving 35 billion a year in excise tax. At ang higit sa lahat, itong industriya nito ay nagbibigay ng trabaho sa 2.9 million na manggagawa. Kung hintuin mo paninigarilyo, paano na yung 2.9? Kawawa naman sila, di ba? Ano, Yusek? Hindi ba? Ilocano rin si Yusek magre-rebelde ang mga Ilocano. Sila nagtatanim ng tabako. Nga po. Wala na silang hanap buhay. Kaya sabi ko, tayo, sundin natin yung batas. Sundin natin yung batas. At ang sabi ng batas, may specific space. At sabi ni Sec Mon, sige, pwede kayo dyan, pero may division para hindi kayo magkatabi. Yun po ang protocol. At saka yun, meron kayo nito. Meron kayo nito. Marunong kayong gumamit ng alcohol. Ito, kamuntik kong mainom. Akala ko juice. Yung pala alcohol, yan po, palagi kayong may alcohol para meron kayong panlinis ng kamay ninyo. Ayan po. Hindi na po ako magtatagal. Marami na po silang sinabi. Ang mga namamala sa COVID. Sana si Sec Vince? Wala na si Sec Vince Yan, si Sec Vince, yan ang mga bala. Kung tumataas ang COVID incident, kasalanan ni Sec Vince, kasalanan ni Sec Roque. Yan, Pero pag gumanda ang panahon, nawala ang COVID, you can credit it to President Duterte. Kasi sabi niya, papatayin niya pati COVID. Lamang po, magandang hapon po sa iyo at maraming salamat.
Maraming salamat po, Secretary Bello. Now, to represent the Secretary of the DILG, Sec Eduardo Arnio, may I call on Yusek Jonathan Malaya.
Okay, magandang hapon po sa mga secretaries natin, Governor, Sir, sa mga mayors po natin dito sa sa probinsya ng Cavite. Hindi ko po alam, ako po lang magsasalita. Anyway, nandito naman po si Mayor Benji Magalong and I'm sure si Mayor will emphasize yung ating pong kakulangan sa contact tracing. Alam naman po natin yan na ipinakita doon kanina sa presentation ng ating probinsya na ang ating contact tracing ratio dito ay 1:4 lamang. Meron na pong bagong protocol na sinusunod ang ating National Task Force as recommended by Mayor Benji Magalong. Ito po yung 1:37 para sa mga urban areas at 1:30 naman para sa mga rural areas. Kanina po kausap ko po yung aming provincial director at tinanong ko kung bakit nasa 1:4 pa lang tayo. Yun pala ang ginagawa ng ating mga contact tracers ay yun lamang na immediate contact noong pasyente. Hanggang 4 or 5 lamang ang nako-contact trace. Kung yun lang po ang nakahalubilo ng ating pasyente, kailangan po pumunta tayo dun sa 2nd degree at 3rd degree. Yung mga nakahalubilo pa nung 4 or 5 na contact trace. Yan na po ang challenge sa atin ngayon dahil contact tracing is the only way we can stop the transmission outside of a lockdown. At ayaw naman po natin yung lockdown ng lockdown dahil hindi nga po makapagtrabaho ang ating mga kababayan gaya po ng sinabi ng ating DTI Secretary at ng ating Secretary of the Department of Labor and Employment. So, yun lang po ang aking mensahe para sa ating mga local government units. Kayo po ang chairman ng inyong COVID Task Force. Ang National Action Plan po ay nationally determined but LGU-led. So ito pong contact tracing na ito, sana po araw-araw i-monitor nyo yung inyong mga SESU, itong mga MESU, at siguraduhin na araw-araw po ay nako-contact trace natin within 24 hours from the time na yung pasyente ay magpositibo, kailangan po gumagalaw na ang ating mga contact tracing teams. At mamaya po, ipapaliwanag po yan ni Mayor Benji kung ano po yung mga magagamit nating mga sistema at protocol para mapalakas po natin ang ating contact tracing capacity sa ating lalawigan. Maraming salamat po muli at mabuhay po kayo.
Thank you po, Yusek. Our next po na magbigay ng message po. Siya po ang treatment star, our Yusek Leopoldo Vega from the DOH.
Governor John Rick Remulla, the Honorable Secretaries, Mayors, USECs, and my co-workers in government. Magandang hapon po sa inyong lahat. And maikli lang po to, I'll be talking about the treatment dimension of ito yung ano natin, kailangan natin i-prepare. Kung sa data kanina, nakikita natin yung pag-present na yung utilization rate ng beds, isolation and ICUs, dito sa Calabar Zone, umaabot na sa mga 64, 65. Ito ay medyo nasa high risk category na. Ang unang ginawa ho namin to make sure that we were able to make a proper coordination sa referral system, nagtayo kami ng one hospital command para magkaroon ng coordinated care. Ito yung na-launch namin last week at ito ang platform nito nasa FMMDA at makikita namin dun sa dashboard yung mga beds na utilized and vacant. So, inaano ko sa mga different hospitals, yung surveillance officer nila, binaba na ho namin yung document for encoding. Kasi ang pinaka-challenge ho dito talaga, so that we will have a rational decision on where to send our patients, kailangan updated and on time yung pag-encode ng surveillance officer ng mga hospital so that this will be collectively stored in our data collect and bed tracker. Kung makikita nyo po, ito yung dashboard na nagbibigay sa amin ng real time kung ano ang kailangan ng isang hospital in terms of resources at saka especially yung care, coordinated care. Pangalawa po, ang aming ina-emphasize ngayon, or we're pushing forward, ang expansion ng ating health facilities at saka networking. Ang una hong ginawa namin, kasi alam naman yung Calabar Zone, it's getting to be a highly, critical na yung utilization nila ng mga isolation and even ICU. Kaya napunta ko kami sa Bacoor and Imus na nagkaroon kami ng network. Ginawa namin yung mga local government doon, yung sa Imus, at saka sa Bacoor Doctors, at saka ho doon sa Las Piñas Medical Center, na magkaroon sila ng isang magandang referral system. In fact, ang balak ko namin, magtayo niya ng isang government na purely COVID. Ito yung na-identify namin ay yung Las Piñas. Kung ganun ang strategy natin, makikita natin na may mga referrals natin at saka yung mga moderate and severe cases na kaya i-manage ng isang facility na level 3. Pangalawa po, nag-coordinate na rin kami sa private sector. At sa mga private sector po, yung plea ng ating Honorable Secretary Duque na kung pwede itaas niyo yung level of allocation for the number of beds. Makikita natin na siguro sa track na sa aming dashboard, meron pa rin mga 10-12% ang allocation. Ang target po natin 20% sa private kasi kailangan natin yung magkaroon ng allocated beds for COVID kasi tumataas ang inyong admissions. And sa private naman, ang ginawa ho namin dito sa Carmona, Santa Rosa pala, I'm sorry. Ang Qualimed Hospital na private, gagawin nilang mostly COVID at saka yung kanilang extension ay yung SEDA Hotel. So yung SEDA Hotel, doon nila i-manage yung mga mild, moderate na nakukuha nila sa Qualimed sa Santa Rosa. So ito yung mga pamamaraan na we can make sure that we have the capacity to take care of our patients. So ito yung ginagawa ho namin to make sure na ready tayo in time kung magkakaroon ng surge. Pangatlo po, dito sa Calabarzon, iisa lang kasi ang ating sa DOH retained hospital na malaki. Ito yung nasa Batangas Medical Center. Pero kung titingnan yung Batangas Medical Center po, kasi referral center na siya ng Calabarzon area, tumataas na rin ang kanila, umaabot na sila ng mga 80% eh. Pero ang bed allocation nila, mga 30 to 35%. Ang nangyari po dito sa Batangas, kasi ang dami ding mga non-COVID referrals coming from all provinces na hindi naman nila matanggihan. No? They cannot refuse. Kasi sila yung end referral center. So ang gagawin po namin, nakipag-ugnayan po ako sa DPWH na magtayo ng modular hospital na popped up na gagawin in 2 to 3 months na good for 110 beds. Nakakita na ho kami ng site dun sa Batangas Medical Center, may space na, at ready na rin ang DPWH to come up with parang popped-up modular hospital capable of handling moderate and severe cases. Kasi ito ho, ang design ho nito, meron ng oxygen pipelines na pwedeng gagamitin ng mga pasyente. So ito yung mga pamamaraan ho namin in terms of expanding our health capacity. Kasi kulang talaga. And at this time, dapat all of us should be ready in making sure na yung COVID patients natin coming into the institution or to the facility must be managed and can have proper access to our health services. Maraming salamat po at good afternoon to you all.
Thank you po, Yusef Vega. So our next speaker po, the last but definitely not the least, yan, siya po yung ating tracing SAR. Okay, the tracing SAR of the code team, Mayor Benjamin Magalong.
Maraming salamat. Governor John Vic, our District Secretary, led by Secretary Pincoy, my fellow mayors, my colleagues in public service, and our uniformed personnel led by General Kit. Sa inyo pong lahat, magandang hapon po. This will take about 20 to 25 minutes, so please bear with me. Siguro nagtataho kayo bakit sa inyong mga lugar tuloy-tuloy pa rin magtaas. Ginagawa nyo naman po lahat. Tama naman po yung ginagawa niyong testing. Tama naman siguro yung ginagawa niyong mga preparations at preventions. Bakit po tumataas? And let me just show you the reason why. Pwede yung isang slide, yung diagnostics sa Bacoor. Let me show you yung situation ho sa Bacoor. On the second week of July, when a week before that, si Mayor Lani po ay tumawag sa akin asking help to analyze the situation in Bacoor. Okay, ganito po yung situation ng Bacoor. That was second week of July. The total number of cases is 476. And according to them, the number of cases daily is 12. So what they're doing is per patient, ang nako-contact trace lang nila is 7. And the number of RT-PCR tests daily is 71. And their operating teams is 3, the number of members is 5. So total na contact tracing personnel nila is just 15. Ang estimated population nila is 600,000. Now, it was always mentioned to you that our contact tracing efficiency based on empirical data is 1:37 for urban and 1:30 for rural. That should be our target. Please take note of that. Ang mangyayari po nito is, during contact tracing, siguro makakontact trace nyo po from 40 people or 30 people hanggang 150. Ang pipiliin nyo lang po dyan are high-risk contacts. Ibig sabihin, meron yung close contact ng positive patient and then meron yung close contact nung potentially na infected nung positive patient. So merong F1, F2, meron pa hong F3. Kung titingnan nyo po, magbabacktrack po kayo ng 2 weeks. Aabot po kayo dyan sa 1:37. Now, let me go to the next slide. Look at this. Simple analysis, simple math. The total number of high-risk contacts being traced daily. Yung 84 po, galing po yan dun sa 12 times 7. Yan po yan, 84. When supposedly, ang nako-contact trace nyo using that benchmark should be 444. So look at the big gap, big number. Around 360 high-risk contacts are unaccounted. And if this trend continues for 10 days, dagdagan nyo lang po yan, zero yan, 3,600 na. Now, the current positivity rate of Bacoor is 15%. If you look at 15%, times nyo yan sa 3,600, after 10 days, you're looking at 540 potentially infected individuals roaming your streets. And look at your swab test and your contact tracing ratio using your actual figure. 71 lang po ang sinasab nyo. Ang nako-contact trace nyo daily is 84. Pero if you're using the benchmark, 71 divided by 444 supposedly, your swab or RT-PCR test efficiency is just 16%. And that's the reason why that explains basically what is happening in Bacoor. The good news is, immediately, nung ni-raise ko to kay Mayor Lani, gumalaw na kagad sila. Ang sabi niya sa akin, in 1 week or 2 weeks, we'll put everything in place. We came up with a strategy, we discussed it, there was an alignment, in-implement po nila. I've been hearing that, ang sinabi ko kay Mayor Lani, please expect an upward trend, a very, very sharp upward trend in the next 3 weeks. On the 4th week, you'll see a plateau. On the 5th week, bababa yan. And it's now going down. That was 2nd week, based on our projection. Nag-plateau na kayo, Doktora, and you're going down. Bumababa na ho yung data nyo. Okay, 1:25 na kayo. Look, they are doing it at 1:25. Coming from, yes, thank you. After coming from Cebu, pinuntahan ko kagad ang Muntinlupa. During that time, ang Muntinlupa nasa 1:9. Now, they're doing 1:18, 1:20. Average 1:19 ang Muntinlupa. Pero tumataas yung kaso nila. But at least we know what is happening on the ground. Ang importante rito is situational awareness. Just like in the military, in the battlefield, you have to know what is happening on the ground. So don't be surprised kung tumataas bigla. If you're enhancing your contact tracing, definitely you'll see a very sharp upward trend. Don't be surprised. Now let me show you what is happening in the entire province of, pwede ba kikuha lang yung whiteboard? Entire province of Cavite. In Cavite, your total case, you have 2,131. Your daily cases is 64 per day. I'm sorry to say this, Governor John Vic. Your figure, Gov, this figure is artificial. That is an artificial figure. Because your contact tracing, your city, your contact tracing efficiency ratio, 1:4.45. That is 1:5. Or nandiyan kayo sa 1:4. If you look at this number, with a benchmark of, let us say, for easy computation na lang, 1:30. 1:30. We're using the 1:30. At 64:30 times 64. Dapat ang nako-contact trace nyo is 1,920. At 64. Pero ang nako-contact trace nyo lang, times 5 na lang natin, is just 325. Ang missing nyo is around 1,600. Every day. You're looking at 1,600 every day. In 10 days, if this trend continues in 10 days, you have 16,000 with a positivity rate of 15. O sabihin na lang natin, 10%. You're looking at 1,600 people roaming your street in the entire province, potentially infected. So we need to level up. We need to level up. We have to take contact tracing to the next level. And so my appeal, if you're looking at the 4 pillars in COVID-19 or in our COVID-19 operation, testing, treatment, isolation, and tracing, there is one particular pillar wherein local government units have full influence and control. Hindi po sa testing, hindi nyo po kakayanin sa laki ng gasto sa testing. Bahala na po si Sec Vince dyan. Hindi rin nyo po kakayanin sa isolation. Sa laki rin po ng gastusan dyan. You cannot. Local government funds cannot support the facilities. Putting up all these facilities, the cost is huge. Let Secretary Villar take care of that. Same thing. Same thing with treatment. So expensive. Magkano ang remdesivir? Remdesivir at cost 7,000 per vial. How many do you need per patient? 11. The 77,000 sa Cardinal Santos is about 800,000. You cannot cover that. The cost is too huge for you to cover. Let USEC bong, but not contact tracing. You're in full control of contact tracing. Sa pag-iikot ko po, isa lang po ang nakita ko kung bakit nasa malungkot po tayong sitwasyon. I hate to say this, but contact tracing is left under the management of our municipal health officer. Pero you should understand na marami po tayong obstacles, marami pong hindrances sa contact tracing. Ayaw makipag-cooperate ang barangay officials. I saw that in Cebu. Who will resolve that? The mayor can resolve that. Kailangan ng panggastos ang contact tracer, idadaan pa sa bidding process. But actually, the mayors can easily resolve that. Away-away ng mga department heads, which impacts contact tracing, the mayors can resolve that. So my appeal to you, Mayor, my fellow mayors, please, let us be directly and actively involved in contact tracing. Otherwise po, with this figure, it's pathetic. Kaawa-awa po yung figure na yan. I don't think we will be able to solve this COVID-19 situation natin ho ngayon. The worst is yet to come, believe me. The worst is yet to come. Ngayon, marami nagsasabi, there are people who are very pessimistic, saying na, or kaya, they're just so negative about it na imposible makuha namin yung 1:37. Sobrang taas. Believe me, if we set our eyes, if we focus on contact tracing, you can do it. We even reach 1:43 per patient. Pero maski na, sabihin natin na katulad sa Bacoor, nandun na sila sa 1:25 or 1:20 like Muntinlupa. Kay Mayor Joy Belmonte, nung nag-uusap kami noon, nasa 1:6 lang siya. Ngayon, nandun na siya sa 1:23. Yeah, it's true. You will not be able to reach 1:37. It's fine. Pero wag naman sana ito. Wag naman sana ito. Dito po tayo. Now, the big question is, how do we sustain yung testing? How do we sustain testing? Like for example, ang Cavite, assuming that they have to test 1,920. Pero ang binibigay lang naman pala sa kanila na testing kit is 386. There's a big gap. Ang laki po nung gap. So, SecBing, I'm sorry to bother you, Sec, but you need to cover this every day. And the 20,000 that we just issued is only good for 8 days. We need to cover this. So from here, we will just show you a 5 minutes or 10 minutes presentation. Thank you, sir. Thank you po. Okay, pakitanggal lang ho yung whiteboard. Pasensya na po. So we'll just give you an idea about contact tracing, what we're doing, what is our strategic focus. So more than 3 weeks ago, I was given that big responsibility of leading or taking the lead in contact tracing. Immediately, we pursued the strategic focus. We're doing capacity building, going around the different regions, doing a lot of training on the training module being propagated by the Department of Health on contact tracing. Ang sa amin is just a retooled contact tracing, and that's why we are concentrating on cognitive interviewing at yung data analytics. Next is, we are now working with the uniform data collection tool. Kasi ang nangyayari sa ating mga contact tracers, nagdo-double encoding, nagti-triple encoding pa. It's about time that national government should come up with a uniform data collection tool. Para iisa lang ang encoding, and at the same time, that data collection tool will be able to support analytics. Ang nangyayari ngayon is we have to comply with COVID Kaya. It is a very good management information system, but unfortunately, it only supports clinical analytics. So we need something to support our different analytical tools. Pero kailangan ho natin mag-comply sa COVID Kaya. So we're coming up with a data collection tool that wherein we can migrate data to COVID Kaya. Digital contact tracing is also one of our strategic programs. We're now working with Stay Safe. Siguro yung local government ho ng provincial government ng Cavite, you have your own digital contact tracing app. Please pursue it. Kung meron na po kayo, pati ho yung mga mayors ho natin, kung meron po kayo, please pursue it. Pwede na ho natin i-synchronize. In layman's term, pwede naman ho natin i-synchronize doon sa Stay Safe na application. It's just a matter of coming up with that specific interface, yung tinatawag ho nating API. And then we will continue to support the local government units insofar as diagnostics and crafting of the contact tracing strategies concerned. Just like what we did with Bacoor, Cebu City. Cebu City, when we went to Cebu City, nandun na sila sa 130 a day. 130 a day. Now, bumababa na po ang Cebu City. We visited Cebu City first week of July. Ang laki po ng problema nila doon. But, because of the enthusiasm of their mayor, local government, and at the same time, tulong po ng IATF Visayas, slowly po, bumababa yung kanilang cases doon. Next. Now, these are the 8 regions that we're in. We were able to conduct actual training. We visited them. Next slide, please. And some of the regions, it's impossible for us to take a flight, so we're doing virtual training. Please go ahead. Next slide. So we have covered 10 regions. Meron pa kaming 3 regions na pupuntahan. And these are, tapos na ho namin na Region 1. These are Regions 8, Regions 10, and Regions 4B. Go ahead, please. Next slide. Next slide. Next slide. Okay, we have drastically changed the structure of the COVID-19 or COVID contact tracing organization. Now we're putting in analysts, encoders. You should understand that we are here dealing with data. We need some applications or tools to analyze big data. That's why we need those analysts. Of course, the data encoders, the community support, and the technical support. That should be your organization. Yung contact tracing interviewers or tracers, one team should be composed of a health worker and a law enforcer or military. Kukulangin po kayo. Ang dapat po yung ratio dyan is for every case, daily case. Look at your daily cases. Dapat po 3 teams per 1 case. Ideally, 3 teams per 1 case. Kung hindi ho talaga kakayanin, it should be 1:1. Ngayon ho, the good news is the PNP is already on board. The PNP will not decline. If you need, let us say, 20 people to organize 20 teams, the Philippine National Police is mandated to provide that number para may kapartner po yung health worker. Ang contact tracing parang investigation po yan. Para kayo nag-iimbestiga ng isang serial offense, criminal offense. So it requires someone with an investigative mindset to do it. That's the job of the law enforcer, but they cannot do it alone. They need the expertise of our health workers, our doctors and nurses. Sila po nakakaintindi ng infectivity. Sila po nakakaintindi ng incubation. Sila nakakaalam ng high risk, low risk, moderate risk. But if you combine both, their strength complement each other. So you need them as a team. Same thing, if you run out of PNP, the AFP will provide your manpower. Nandyan si General Kit, we have his commitment. Next slide, please. Okay. Every time we do a lockdowns, you need to be very transparent about it. You have to explain the process. We're now working on the frequently asked questions. We need to keep on empowering our barangay officials. And of course, the facility should be known by the people in that barangay. Next. So yung how to measure yung performance ng local government in terms of contact tracing, and we have this key performance indicator. So 1:37, actually 1:30 to 37 yan, yung urban. But we go for the upper marginal number, 1:37. Same with rural, it should be 1:25 to 30. But we go for the upper marginal number. Next. How fast should you do your contact tracing? In 24 hours, dapat na contact tracing na 70%. 70%. Okay, next. Your swab test and contact tracing efficiency, dapat lahat po ng inyong nako-contact trace ay dapat nasa swab. And that's the reason why we need the commitment of Secretary Vince. Kaya ho siya nandito. Kaya ho siya kagad nagbuhos ng 20,000. Doon sa Bacoor, nagbigay kagad siya ng 4,000 to support yung effort po ni Mayor Lani. Next. Your isolation speed, how fast? Once you have traced, how fast would it take you to isolate the patient? It should only be within that number of hours, 1 to 3 hours. And finally, you need to really organize. Next slide. Isa pa is the use of analytical tools. We're using a GIS platform, a link analysis, and the Stay Safe platform. Maganda po yung Stay Safe platform because that would be a digital contact tracing. Ganun din po. We're now working with another group for the QR codes. So a combination of our existing contact tracing system and enhanced further by the digital contact tracing at yung QR codes, masyado at lalakas pa ho lalo yung ating contact tracing capability. Next slide. And then you need to organize. You have to make sure that please follow this organization. And then the last, another 3 minutes, please. Yung last na slide. And this is, by the way, our contact tracing, sandali lang, iho. Our contact tracing operation center. Nawala yung picture. Pakibalik mo lang. So this is our contact tracing operation center. We have renovated it. And this is how it looks now. Everything there is digitized. And digitalized. Okay. So next. We'll now show you the capability of the different analytical tools that we have. And this is something that we are now sharing with all the local government units. Okay, pakiclick na lang. We'll just show you a short video of this. This is a 30-second video. And this is the GIS platform. If you look at it, it is basically a GIS software wherein you can put in everything. You can manage, you can analyze, you can store data. This is what we call geospatial analysis. Every time you click a particular icon, it gives you basic information or essential information about a particular positive patient. Yun yung tinatawag ho natin na attribute. And then you can zoom in, you can zoom out, you can use different types of algorithm to generate yung heat map. Ang technical term ho niyan o hotspot, ang technical term niyan is near hierarchical cluster analysis. You can zoom in, you can zoom out, you can use different types of map. You can use vector map, raster map, or satellite map, or street map. If you lock down a particular use your containment zone, you can, basically put in some layers, different types of layers. Okay, next. Yung link analysis naman, itong GIS platform na yan po yung sa Philippine National Police na tinatawag po dyan is Crime Information Research and Analysis System. Instead of crime mapping, ang gagawin lang po natin is case COVID-19 mapping. So alam na po ng PNP, all you have to do is get in touch with your PNP because every police station has its own CRAS officer. Ito naman po yung link analysis. If you look at it, it's a bit complicated. It might look complicated, but actually it's not. You have your own analyst to work on it. So don't get bothered by the the complications of this software. So ang maganda ho dito sa software na to is does not only link one particular patient to another patient or to another contact. It has its own story, establishes a story, it has substance, it has content. Ito po, ginagamit po ng PNP to. This is what we call the case management and analysis system. Ang gagawin lang po nito, we're using it to investigate high-profile cases. Now, we're going to use it for COVID-19. Now, the big question is, magkano naman yan? Magkano naman yan, Benji? Gaano kamahal yan? This is free. We're giving it to you for free. So, yung mga nag-training po, 3 weeks ago, doon po sa Batangas, nakasama na rin po yung Cavite doon, yung ibang, yung buong Calabarzon. Lahat po ng computers po ng inyong mga analyst na pinadala, nilagyan po namin ng mga software na yan. So, that is all. If you have any questions, I'm ready to answer them. Maraming salamat po.
Thank you very much po, Mayor Benjamin Magalong, our training czar. Napaka-informative po ng inyong pinresent. So, we are now going po sa ating open forum and discussion. So may I request po the members of the response cluster lead to assist po in the facilitation and moderation of the open forum. May I mention also our response cluster leads are as follows. For governance, as well as the management of human remains cluster, we have the Provincial Director of DILG, PD Lionel Dalope. For the law and order cluster, we have Provincial Director, Police Colonel Marlon Santos. For economy cluster, we have our PPDC, Jesus Barrera. For food and non-food cluster, we have PSWDO, Ma'am Felipa Cervantes. For logistics, we have our GSO head, Mr. Ferdinand Belamide. For the crisis communication cluster, we have our OIC of PICAD, Ms. Evelyn Reyes. And for the health cluster, we have our OIC of PHO, Dr. Noni John Dalisay. So sa atin pong mga mayors, ayan, now is the time po para makapagtanong po tayo sa ating mga secretaries, USEC, ASEC, and as well as sa ating mga SARS na nandito po ngayon. So kanina napakaliwanag nung binanggit ni Mayor Benji regarding sa 4 pillars, the testing, treatment, isolation, and tracing. And yun pong maitutulong talaga, especially ng ating mga LCs, is about the tracing. Ang sabi ko kanina, tandaan nyo, yung naunang 3, ipagbahala nyo na po sa ating mga secretary at sa ating mga SARS. So, ayun po. Any questions po? You can... Yes po. Saan na po yung ating...
Good afternoon po. I am Attorney Christy Mangabat from Magallanes, Cavite, representative of Mayor Jasmine Angeli Maligaya Bautista. She sent me a question. Can we demand the private companies to coordinate or communicate directly to LGUs if they have an ongoing company-initiated testing to their employees, to disclose to them right away to the LGUs? Because in our case in Magallanes, we have, for the longest time, we were COVID-free, but in some instances, these workers would just come home, already had their swab test, but we didn't have any information about that. can we impose to these companies to give the LGU information of their company-initiated swab test or rapid test? Company po. Yung mga nagtatrabaho po sa companies nila, nagkakandak po kasi yung mga companies pag minsan po ng kanilang swab test. Okay po. Yung po kasing ibang private companies, nagkakandak po sila ng rapid test or swab test without informing the LGUs. Now, kung halimbawa po, nakapag-swab test na sila and rapid test without the result yet, aalis, lilipat, uuwi without informing the LGU kung nasaan yung company na sila ay nag-conduct ng swab test. Yung mga empleyado, and then wala pong information na ibinabato sa LGU.
Pagka nagpa-swab test po kayo at hindi mo pa nalalaman ang resulta, pwede ka naman hindi pumasok. Pwede naman, oo. Pag hindi ka naman pumasok, no work, no pay. Pero hindi ka pwede tanggalin dahil hindi ka pumasok. Ayun po.
Kaso po, ang nagiging problema po ng ibang LGUs, yung pong mga companies na nag-conduct po, hindi po 100% nire-report sa LGU na sila po ay nag-conduct ng rapid test or swab test sa mga empleyado. So, nagkakaroon po kami ng problema sa, halimbawa po, contact tracing. Umuwi na pala si empleyado na nagpa-swab test po nang wala pang result. And then, biglang magkakaroon na ng positive result. So, kalat po yung contact tracing from, halimbawa po, ang company is from other cities. Umuwi sa city namin yung empleyado na nagpa-swab. Wala pong information yung ibang companies sa LGU na nag-conduct sila po ng swab test or rapid test po.
Hello. Ang concern niyo po, yung company na nagko-conduct ng swab test. Rapid test. Hindi sila nagbibigay ng resulta sa mga LGUs.
Kaya po hindi po sila nagpapaabiso
na mag-test sila.
Tapos po, yung empleyado, pagka-test, wala pang result, nagpupunta po.
Okay. Ayun, yung sasagutin ka ni, sasagutin kayo ni Secmon.
Ma'am, dun i-clarify ko lang then, of course, Sec Duque can add. Dito po sa bago nating protocol na binasa ko kanina, isa po doon yung requirement na mag-coordinate yung mga companies na magpapatest yung empleyado. Coordinate na agad sa LGU, dun sa kanila at saka yung LGU of resident nung taon na yon. Kasi noon ang nangyayari talaga, until now, yung mga company hindi rin nila alam yung SOP na kailangan pala inform ko yung LGU. So tama ho yung concern nyo, kaya ho in-address na natin dito sa bagong maglalabas ho kami nung signed memo circular today or baka tomorrow na yon. But kasama po doon yung in fact, before the testing, i-include na po, i-inform na yung LGU's concern para ho, sabi nga natin, ma-monitor, matrack na kung ano man ang resulta nun at kumbaga makatulong sa contact tracing ni Mayor Benji na talagang matitrace na yon pati yung mga nakahalubilo niya. No? So, required na po yan ng mga company. Ito pa ho, isa pa. Madalas na tanong, paano yung symptomatic, doon pa lang, nasa bahay pa lang. So, tinatanong ng company, hindi na namin alam nangyari dyan. So, yung mga nasa bahay, hindi kailangan pumunta ng opisina para magpa-test. Kung symptomatic ka na sa bahay, diretso ka na sa DOH, barangay, or yung barangay health, anong tawag doon, BHERT, doon ka na sa barangay of residence mo, makikipag-coordinate at tatawag ka rin sa DOH, may hotline para matingnan ka agad kayo. Ang point, hindi na kailangan pumunta yung worker sa kumpanya, sa opisina niya, sa place of work.
Pwede pa po bang isa?
At dagdagan ko lang po, yung pong mga mayors, meron po kayong kapangyarihan under the Disease Notifiable Act, RA 11332. At makipag-ugnayan po kayo doon sa mga namumuno o sa mga managers doon po sa mga kumpanya at sasabihan niyo po sila na kinakailangan po nila i-report ang lahat po ng resulta na naganap na testing sa kanila pong companies. And they cannot escape that because it is statutory or legal requirement. So you can actually send a memo to all of these company managers to tell them to report all tested individuals and their corresponding results. And that will be given to the local epidemiology surveillance unit, yung LESU officers ninyo, kung SESU or LESU or MESU or PESU. Lahat yan, meron naman po kayo ng sistema. At from the LESU, pwede na pong dalhin yan, ipadala sa atin COVID kaya. Para yung data natin, data generation, ay talagang sadyang makatutulong sa atin through data analytics, magagabayan tayo kung ano yung next steps natin na dapat gawin. Hindi po, kung wala po tayong ganun sistema, magulo at ahantong sa kalituhan. Kaya ayaw naman po natin mangyari yun. Kaya ako po nakikiusap sa mga punong lungsod, punong bayan, sulatan po at makipag-ugnayan sa mga company managers. And always reiterating the RA 11332.
Thank you so much po sa mga sagot niyo.
Good afternoon po, Secretary. Secretary Mon Lopez, excuse me po. Mayor Eric po from Mendez, Cavite. Related po doon, papangalanan na ho natin yan. San Miguel Group ho, nag-mass testing sila 2 weeks ago, naging problema ho naming lahat. Bakit po? Kasi walang maliwanag na protocol sa kumpanya. May initial coordination kay Mayor Oni, no? Yung company. Pero lumabas ho, alam niyo ho ba, merong mga nag-positive, nag-commute na lang pa uwi. Oho. Kasi hindi ho maliwanag yung instructions ng company. Tapos, darating na lang ho yung mga tao, nangyari ho yan sa 13 Martires. Nag-meeting ho kasi kami mga mayor. For information, ako kasi yung president ng grupo namin. So, isa ho to sa concern. Isa ho to sa concern. Darating na lang yung tao, sa kanya-kanyang barangay, Kapitan, positive ho kami. Anong pruweba nyo na positive kayo? Wala, verbal lahat. So, uwian yung mga tao. Ito ho yung isa naging spike 2 weeks ago dito sa Cavite. And until now po, medyo nahihirapan ho kami dahil dun sa coordination ng walang mga HR departments. Yung mga HR managers ho nila. Ang kalahong second hand info, pero pwede i-confirm ni Mayor Oni, inire-report nila yung pangalan sa head office. Ayaw na lang i-disclose dito. So this is actual, legitimate, real concern naming mga mayors ngayon. Na hanggang ngayon, may mga ganun pa rin kami nagiging problem.
Salamat, Mayor. Actually kaya ang DILG, I hear also si Sec Anyo always saying na yung coordination ng company at yung LGU, immediate sa agad kasi para hindi na pauwiin yung tao lalo na kung nag-positive. Yun po yung purpose na kaya ho in the new protocol, nag-require din tayo na mag-set up ng isolation facility which is 1 for every 200. Parang ang average 0.5%. Para sa mga cases na nag-positive na, huwag nyo nang pauwiin, i-isolate muna hanggang makahanap ng actual quarantine area niya or hospital kung symptomatic. Kung asymptomatic, isolation. Kasi isa pang problema sa bahay, alam natin na hindi lahat solo niya yung bahay at may solo toilet. Magkakahawahan talaga. Isa pa, may mga storya na hindi pa umuwi diretsong bahay, nagpangalawang trabaho pa. So lalo pang nagkalat dun sa second job. So, malaki ho talagang pagkakamali. And I would say, initially, ito yung mga birth pains natin ng lack of coordination. But I think we are all conscious now na i-strengthen yung coordination na yung mga ganong cases, ang SOP dyan ay dapat talaga hindi na palabasin yon, mag-isolation na kaagad yung tao na yon. At mag-coordinate na dun sa LGU muna doon para ma-monitor na. At ang DOH at DILG naman, may SOP sila dyan, hindi ko na-cover yon, kung saan sila dadalhin. Whether quarantine na, hihiwalay na ba sila doon sa mga designated quarantine area. So, Sec Duque.
Yes, dagdag ko lang din po, Ginoong Mayor, na habang nakikipag-ugnayan kayo sa mga factory, yung mga managers, no, nasabihin ninyo sa kanila na talagang i-report. It has to be already standard operating procedure with a legal basis. Yung sinabi kong Disease Notifiable Act, andyan naman po ang DILG para makipagtulungan sa enforcement. Number 2, yung requirement na gagawin po ng DTI na magkaroon ng mga sari-sariling mga isolation and quarantine facilities within the factories or the companies, kailangan ipatupad po nila iyan. At habang ginagawa yan, yun naman minimum health standards, yung protocol ng wearing mask, huwag kakalimutan. Kasi ito po nakakatulong, ang face mask, ang physical distancing, ay itong mga bagay na praktikal na hindi ka naman talaga gagastos ng napakamalaki. Ngunit dapat ito ay parte na ng normal na pamumuhay natin. That is also true for all the employees in the different factories or companies. So, nag-usap kami ni Secretary Mon Lopez na kanila pong, hindi ko alam by how it will be enforced, maybe Secmon, yung pagtatalaga ng protocol officers in those companies. Okay, so required na. Thank you very much for acting on that expeditiously. No? So, ang ating pong talagang sistema, it has to be in place and it has to be mindful that the approach to crushing the clusters, durugin yung mga clusters, so whether it is in the workplace, in the factories, in the whatever setting, no, is yung 5 components talaga. Prevention, minimum health standards, yung early detection, aggressive tracing, aggressive testing, isolation, treatment, and reintegration. So, ang view kasi dyan, hindi pwedeng testing lang, o hindi pwedeng contact tracing lang, o hindi pwedeng isolation lang. Kailangan talaga magkakasama po ito. That's how we need to fight the virus. It's a broad front approach. Broad, wide approach to beating the pandemic.
Dagdagan ko lang na mabilis, Mayor, yung concern, no? Kasi nakita rin namin to dun sa Laguna when Sec Vince and I went to Laguna. Nagkaroon din ng ganong sistema yung nangyari sa San Miguel, yung sinasabi nyo. Tapos nag-uwian yung mga empleyado sa kanilang mga bayan, iba-ibang bayan. At hindi ipinaalam nung may-ari or yung plant manager yung resulta ng test dun sa iba't ibang bayan. Ngayon, since ito po ay inter-LGU na GOV, ang ginawa po sa Laguna ay yung Laguna Provincial Government ang nagmo-monitor ngayon. So yung planta na may madaming empleyado sa iba-ibang bayan, magre-report sa probinsya, sa provincial SESU or PESU. Tapos ito na pong probinsya ngayon ang mag-inform sa iba't ibang mga LGU na meron kayong mga positibo na ngayon ay na-identify na naka-quarantine sa planta. Ito po yung sinasabi naman ni Secretary Mon Lopez na kailangan may quarantine facility yung mga planta. So kailangan po talaga meron temporary quarantine facility. Ngayon po, pag ito pong mga positives ay pinauwi na sa kanilang mga bahay, kung wala naman pong simptomas, kailangan po nakaready na kayo sa LGU nyo, nalaman nyo na from the province, na pauwi na sila, para malaman naman nyo at ma-inspect nyo sa mga bahay-bahay kung pwede silang mag-home quarantine. Kasi kung wala silang sariling CR, wala silang sariling kwarto, at may mga matatanda o mga bata sa bahay, hindi po sila pwedeng mag-home quarantine. Ang kailangan po mga yan, ilipat sa isolation center. So bawat LGU po ay kailangan kayong nakahanda ng isolation center. Ngayon, ang Department of Education po ay nagsabi na pwedeng gamitin ang mga public schools bilang isolation centers, no? Inaantay na lang po namin yung black and white niyaan, pero makipag-ugnayan na po kayo sa inyong mga supervisor para po ma-identify na yung mga public schools na pwedeng gamitin bilang isolation center, because in-announce na po ni Secretary Briones na even beyond August 15, pwedeng gamitin ang mga public schools. Up to 50% ng mga public schools sa isang lugar ay pwede pong gamitin isolation center para po hindi na malayo yung Oplan Kalinga, para hindi na malayo yung pagdadalhan ng mga positibo sa isolation center. Pero kung pwede naman po silang home quarantine, pwede naman po yun, so long as na sigurado tayo na may sariling kwarto at may sariling CR at mild or asymptomatic ang ating mga COVID patients. Yun lamang po, Sec.
Isa pa hong problem, wala ho dito si Secretary Bautista. Problem po naming lahat sa mga mayors, yung distribution ho ng SAP ngayon. Bakit po? Pipila ho dun sa MU Willer. Alas 2, alas 3, nakapila na ho. Magbubukas ng alas 8. Pagdating ng alas 11, wala ng pera. Ang sinabi ng national, wag makialam ang local. So, diba? Sana ho, pinili yung local na maganda. Sa amin ho, hindi naman ho sa pagano. Yung 3,268 sa Mendez. Kaya ho namin i-distribute yon, clustering of 500, in 30 minutes nakauwi na ho lahat ng tao. Nakakaawa po mga minamahal kong sekretary, yung aming mga kababayan. Tulad doon yan, tag-ulan. Pipila ho pagdating. Wala hong public transport. May kababayan ho kami, taga-Palakpok ho. Naglakad hanggang Ayala Sirin. Naglakad, wala naman ho talagang pera. Naglakad ho. Pagdating doon, wala na, lagpas siya sa cut-off. Binigyan lang siya ng number for the following day. So, lakad na naman siya. Talaga hong hindi ho, yung round 1, yung selection ng SAP beneficiaries, problema na ho. Ngayon, distribution, hindi pa rin ho maganda ang nangyayari. Ang tanong po namin, kung sana ho, lalo na ho kung maparating kay Secretary Bautista, hanggang kailan pa ho magtitiis yung mga kababayan namin? At talaga pong problema yung sa SAP distribution. At tingin ko po yan, common sa lahat ng nangyayari sa bawat bayan. So, yun po mga minamahal na Secretary. Tapos, quick question lang, Mayor Benji. Scientific basis ng 1:30, this is the worldwide protocol ng contact tracing.
One is to 37 is based on data. Based on our experience.
Based on Baguio experience.
Yes, based on our experience.
Okay.
Na binaba na lang namin, doon sa rural naman, binaba na lang namin. Pero yung 1 is to 37 is based on empirical data yan.
Okay. Sige po. Kasi sa amin ho, basically rural pa ho kami, 4th class municipalities. Kahit ho gaano kami kasipag mag-contact tracing, hindi ho namin maabot yun. At matitiyak ko rin ho, yung nag-positive, pag nag-trace ho kami ng 30, aabutin na ho yan yung hindi na ho talaga naman, wala nang risk of infection. So baka ho, kahit ho pilitin namin yung 1:30, pero realistically and practically, baka hindi na rin, yung 1:30 as a parameter ho. Medyo personally ho, sa aming experience ho, medyo natataasan lang ho, ako personally for our town ho.
Kasi ho, maliit yung ano ho namin.
Oh, kasi kung rural naman po kayo, kanina, sabi ni Mayor Benji Magalong, 1:25 to 30. Kinuha lang niya yung upper limit. Actually, 20. Sabi ni Mayor kanina, pwede na rin po. Pero dapat bilisan talaga yung contact tracing. Within 8 hours ba? 70% in 24 hours. So that's the formula. 70% of the contacts shall have been traced within 24 hours. We have the Dr. Campuet of the WHO. Can you please share the regional, ASEAN or Western Pacific regional formula for contact tracing, if any?
Sir, specifically there's no formula, but we do recognize criticality. So when we talk about critical exposure, it's 1 meter and then 15 minutes exposed without protection. But we do believe that the 1:3 is not enough. So that's one thing. When we begin to understand the big avenues where people are actually removing their protection, we notice households where people are actually removing their protection, or workplaces, especially the ones that were identified already, smoking areas, dining areas, they remove their protection. And at that rate, we understand that no person will have 3 contacts, just 3 contacts. So what we aim for is to understand all the big avenues where people are relaxing their protection and then zoom into that. Yun yung maganda na when we do good inquiry, we look at the 14 days, no person will have just 3 contacts within the 14 days unless they are in quarantine, in strict quarantine. So now that we understand that we're already outside ECQ, we will have more than that. So we encourage bigger numbers.
Yan po. Okay, Mayor, can I just respond to that? Okay, Mayor, I understand, no? There are situations wherein you will be able to contact trace only 8 people. Because hindi naman mobile yung tao. No, let us say, uwi lang siya ng bahay or especially kung siya work from home lang, very limited yung number. Understandable yon. But please, do not aim only for 1:3. The point here is, when we set our target, it's not something that is comfortable. It should not be something that we can immediately reach. Let us push ourselves. Yun ang point dito. Let us push ourselves. Let us aim high. Let us take it to the next level. Let's level up.
Completely agree po, Mayor. Thank you very much. Secretary Duque, sorry Secretary B, about testing. So if you're looking at the numbers, if we have 100 positive cases, at ang target natin is 30, so we need to test those 3,000 individuals
3,000
plus all those symptomatic. Kasi pwedeng hindi yung mga symptomatic na pupunta sa mga RHU na may masakit ulo, may symptoms na pinapakita na COVID. So 3,000 plus all those pa.
Yeah, iba pa yun.
Which we should have that capacity in a day para medyo real time yung ating ginagawa po.
Pero,
is that what we're heading?
Yes, but let me just be very clear that yung mga symptomatics may already be caught in your contact trace individuals, no? Pero pwede rin may separate. Kasi pwedeng may mga mamamayan kayo, hiwalay, pupunta sa facility na meron tinatawag na influenza-like symptoms or illness, ILI. So, you treat that differently. But they have to have a separate team to take care of those individuals. So you're running these things in parallel. Okay? Meron kang patient A, may patient A ka, may patient B ka, magko-contact trace ka for patient A, depending on the variables, kung yung pasyente hindi naman mahilig maglalabas, hindi naman talagang usually sa bahay lang, may edad na. So you can more or less limit yung contact tracing mo and then you profile. And then on the one hand, meron ka mga pasyente sa ibang mga facilities, usually they are identified through your surveillance. Meron kang surveillance officer who will actively locate these people with ILI, no? So either as a facility or actively sought out by your surveillance officers together with your birds. So yun po. So in parallel.
Maraming salamat po. Si Mayor June. Yun din ho yung concern, binulong ho sa akin ni Mayor June. Yung sa SAP din ho. Kasi yung sa SAP ho, nagcro-cross border ho eh. Kasi may identified silang payout center, kahit taga Mendez, ang payout sa Tagaytay. Marami pong ganun dito sa experiences po namin sa Cavite.
Mayor, una-una, we will try to address the concern. We will relate to the DSWD yung concern nyo. Kasi dun sa Joint Memorandum Circular on the Social Amelioration Program Tranche 2, nakalagay doon na pwedeng manual, pwedeng digital. Okay, so given na nagkakaroon ng delay dahil mabilis maubos yung pera sa remittance center, it's possible na mag-manual tayo sa ibang lugar. Ang nakikita ko lang problema is kung naibigay na ng DSWD yung pera sa financial service provider. Kung na-download na yung buong amount para sa mga constituents nyo, sa GCash, sa Paymaya, sa Union Bank, pag naibigay na po, baka mahirap nang ibalik. Pero just in case hindi pa naibibigay sa financial service provider, under the JMC, pwede mag-manual payment. At kung magma-manual payment, may MOA naman na kayo with DSWD, madali nang ibaba yung pondo sa inyo. Nagawa na natin last time, pwede rin natin gawin uli. So we will relate to the DSWD your concern. Salamat po.
Mayor, just to respond, no? Yung response dun sa tanong mo about yung patong-patong araw-araw, no? Alam niyo, I will respond in the form of an anecdote, no? Ito yung nangyari sa City of Navotas, no? Hindi na muna yung Bacoor, kasi Bacoor nagsisimula pa lang, no? The past 2 weeks. Ang Navotas po, mga almost a month ago na, they were encountering a very, very similar problem, no? Na ini-experience natin ngayon, And Navotas is a very small city in NCR. Navotas is even smaller than some of the cities who are here now. Navotas has a population of less than 250,000 people. No? Ang Bacoor has upwards of 300,000. Some of the cities here like Imus, Dasmariñas, General Trias, mas matataas pa yan. No? Nung nakausap po namin si Mayor Toby Chanco 1 month ago, talagang hirap na hirap siya to deal with the cases, no? Yun yung time na talagang nag-spike ang NCR and ang especially Navotas kasi while it has the smallest population, it is the densest city in the country. Yung kanyang number of people per square kilometer ang pinakamadami sa buong bansa. So talagang very, very prone siya to widespread ng COVID-19 kasi dikit-dikit talaga yung mga bahay, and dikit-dikit yung mga tao. So, ang ginawa po namin, together with the NTF, Secretary Duque, Secretary Galvez, is pinuntahan namin si Mayor Toby. Sabi namin, ito ang target mo. Una, pinresent din namin sa kanya yung 1:37. Hindi siya makapaniwala. Mayor Benji, nakagaga mo, no? Sabi niya, imposible yan, hindi ko kaya yan. Pero, slowly, tinaas-taas niya. Tumaas yun, I think, Navotas now is 1:18 or 1:20. Wala pa rin dun sa 1:37, pero significantly tumaas na from about 1:4 to now almost 1:20. Paano niya ginawa yon? Ang ginawa po namin, to to simplify it, sabi namin, Mayor, simulan natin ng ganito. Mag-target tayo ng testing mo per day. No, nagsimula kami, at that time, Navotas was only doing about 300 a day. We raised it to about 500, then 700. Now they're doing on average about 1,000 a day. Similar to Bacoor, no, na nagsisimula ng mag-test ng 1,000. Ano po ang nagawa ng target ng testing? Ang nagawa po noon is, dahil may target siya na itetest niya, every day, talagang forced to good yung kanyang contact tracing teams and yung kanyang B-hertz na mag-trace, na maghanap. Talagang napipigit kasi kailangan niya eh. Kailangan niyang mag-test ng 1,000 a day o 700 a day eh. So, ano na yun, naging parang ano na nila, yung, ano na, naging habit na sa kanila, no? Every day, 1,000, 1,000, 1,000, sometimes 1,2, sometimes 1,5, no? Pero, hindi siya humihinto sa tracing at sa testing. Yung sinasabi ni Sec Duque. Every day, lalo na nung ginonch po namin yung Oplan Kalinga, yung pagsusundo ng mga positive patients from the community na hindi kayang mag-home quarantine at dinadaga namin sa quarantine facility o ngayon sa mga hotel na, alam niyo ho, ang nahuhuli niya every day was, nagsimula, umaabot ng 100. Bumaba ang positivity niya, naging 80. Ngayon, mga 70. Pero alam niyo po, si Mayor Toby, tsaka yung kanyang CHO, si Dr. Padulina, Doktora Padulina, hindi po yan hihinto hanggat hindi nila mapa-quarantine yung kahuli-hulihang positive every day. As in, maniwala po kayo, may Viber group po kami, kamukha po nung Viber group namin with Bacoor. Pagka kami po ay nakausap na ang Dasmariñas, Imus, ang ibang mga cities, magtatayo din tayo ng sarili nating Viber group. No, nakasama nyo kami nila Yusek Bong, nila Sir Benji. Alam nyo po, si Mayor Chanco, hanggang alas 2 ng madaling araw, kahit na meron na lang 5 o 2 na lang o 3 natitira sa city niya, kukulitin niya po kami hanggang alas 2 ng madaling araw para lang mailabas yung mga positive na yon at mailagay sa quarantine facility. Mayors, araw-araw po yon. Maniwala po kayo sa akin. No? Ano po, talagang napakakulit ni Mayor Toby. Pero ganun po talaga dapat. Sabi ko nga kay Mayor John Vic kanina, no? Ang mahirap dito, pag sinimulan natin ito, kailangan committed po tayo kasi gagawin natin to araw-araw. Hindi tayo titigil. Pero maniwala po kayo, alam nyo, kung titignan nyo po ang growth ng cases ng NCR LGUs, ngayon, 2 weeks on 2 weeks, data po ng DOH yan, ang Navotas po ang pinakamababang growth. While other cities are growing triple digit po, ibig sabihin above 100% every 2 weeks. Navotas is growing by less than 10%. So yung sinasabi po ni Mayor Benji, kung gagawin natin to, tuloy-tuloy, huwag tayong titigil, huwag tayong mapapagod. Tama po si Mayor Benji. Makikita niyo po yan, bababa yan. Yung curve na tinatawag nila, magbe-bend yan. Instead of tuloy-tuloy na paakyat na gayon, makikita nyo, babagal, hanggat makikita nyo, nagpaplateau na. Yun po, ang nakikita na natin, nagsisimula na sa Bacoor. Tumataas pa rin, pero habang ginagawa natin to every day, maniwala po kayo sa amin, magbe-bend yan at babagal po yan. Commitment lang po talaga, and nandito po kami. Magtatayo po tayo ng sarili nating Viber group. No? Ang dami na po namin Viber group, 1,000 na po siguro. Daan-daan na yung Viber group. Pero ang Bacoor po, si Attorney Byrne, may Viber group po kami with Mayor Gani. Si Mayor Gani po, ganun din. Hanggang madaling araw si Mayor Gani, kahit naka-isolate siya, kinaalagaan na si Senator Bong. Nagte-text po yan, Gob, 1 a.m., 2 a.m., nangungulit, meron pa kami natitira dito, sa namin dadalhin. Alam niyo po, yung mga ibang taga-Bacoor, umaabot po, anong pinakamalayo natin, Attorney Byrne, di ba? Umaabot tayo kahit Philippine Arena, di ba? Meron tayong nadadaga doon. Pero ganun pong commitment ang kailangan nating lahat. No? Sama-sama po tayo dito and magtiwala po kayo, susuportahan po talaga namin kayo in the same way na sinusuportahan namin yung ibang LGUs. Salamat po, Mayor.
Just a few seconds remark. Mayor, if your contact tracing is 1:4, there's no contact tracing. Why? Let us be honest with each other. You're just simply contact tracing. You're just isolating the family. Nasa family lang yun. 1:4. Ganyan din po yung nangyari sa Cebu. Ganyan din po nangyari sa ibang lugar. So, let us expand po tayo.
Salamat po. Secretary Vince, yung sa question din ho to ng mga mayors yung nag-meeting kami, meron ba tayong capability, kasi lahat nung accredited laboratories, okay, di ba, by the time kumuha silang swab sample, nakukuha na yung data nung nagpakuha ng swab sample. Is there a way na mabibigay na kagad sa LGUs yun?
Alam nyo, dapat po ganun talaga. No, dapat po, I think, kailangan ngang masabihan yung mga laboratories. Halimbawa po, yung mga expanded testing na ginagawa natin ngayon sa LGUs, pati na rin sa Cavite, pati sa Bacoor, na sinimulan na natin. Lahat po yan ay dinadala namin para po hindi masyadong mabigaukan yung mga lab natin dito, ang De La Salle, ang Hospital ng Imus, at yung ibang labs natin sa Cavite. Dinadala po namin yan sa Philippine Red Cross. Dahil ang Philippine Red Cross ay high capacity lab po siya, meaning nakakapag-test siya ng libo-libo kada araw. Marami siyang makina, although ngayon nahihirapan siya dahil sa kakulangan ng medtechs. Pero dun po sa Red Cross, nagbabato po ng resulta diretso sa LGU. Kaya po si Attorney Byrne, saka si Mayor Rani, si Dr. Ivy ng Bacoor, natatanggap nila diretso ang resulta. Attorney Byrne, tama yun, May dalawang email. In 2 days, In 2 days. Thank you. Pero 2 days ba? Minsan mahaba din eh. Minsan nadidelay din. Pero ang importante po doon, natatanggap po ng LGU direkta from the lab yung resulta. Both negative and positive. Attorney Byrne, tama, both negative and positive. May binibigay po silang email sa lab and in 2 days or 3 days, natatanggap na yung resulta diretso sa email ng mayor and sa CHO, sa City Health Official. So, ganun din po dapat, Siguro kakausapin lang natin yung mga ibang lab, para matanggap din ng
This is after
LGU.
the result. Yung pag nag-swab pa lang, kasi makakatulong yun papakwarantina na namin yung pamilya.
Sir, ang nagsaswab po kasi, pagka tayo nag-expanded testing na, kayo ang magdadala ng mga pasyente.
Pero Sek, hindi kami lahat basta na lang kami nasusurpresa. Yung isa ko palang taga-barangay, nagpa-swab sa Manila, nagtatrabaho sa, di ba? So kung alam na namin na nagpa-swab siya early on, nag-aantay lang ng results, ginagawa na namin ng paraan sa barangay, para yung household na yon naka-quarantine na. Hindi para pag nag-contact tracing kami, assuming na mag-positive, konting-konti na talaga.
Sige po, Mayor. We will talk to the laboratories.
Baka makatulong.
And find a way, Find a way. Gago na sa mga factories at sa mga kumpanya.
Yung kinuwento ko kanina, Mayor, na actually si Sec Anyo nag-recommend doon, hindi after the test. Before the test, naka-coordinate na sa LGU ng place of work, pati yung resident LGU niya. So, para before the test pa, ma-inform na. Para alam nyo rin po na, nagpa-test yung taga sa atin at ma-monitor. So, kasama po dito sa company, sa protocol. Ang problema natin, yung outside the company, sa barangay and LGU's concern.
Salamat po. Sec Vince, committed po kaming lahat. Wala pong Caviteño na hindi committed.
Thank you.
Lahat po kami, kapwa nyo naglilingkod, lahat po tayo dito committed para sa laban na to. Maraming
salamat po, Mayor. Thank you so much.
Thank you very much. I guess this concludes. Thank you very much, Secretary. Thank you very much, General. Thank you very much sa lahat na nag-attend. The mayors and I greatly appreciate the communications and the efforts that you have done for us today. Hopefully, the curve will flatten and we'll see a better tomorrow for all of us. Thank you very much.
Thank you po. So, we have okay, for the highlights and summary of agreements, may I call on
Hello po. For the part 2, we will be going to another venue po, to Barangay Habalera. May we know po who is coming from the National Task Force Representative?